My name is Andrea Britchford. I'm a respiratory therapist here at Toronto General Hospital. The first time I had a COVID patient, it was either the end of March or beginning of April. I remember I was working a night shift in the ICU, and this patient was being transferred from a nearby hospital that was very, very sick. That's all we kind of knew. I was with the nurses in the hallway. We were putting on our protective gear, looking at each other to make sure we were covered properly, protected, checking my mask to make sure it was sealed properly. And I remember feeling nervous and sort of staring down the hallway, watching to wait for EMS to bring this patient. When he arrived, it was a young person. They were young, they were fit looking, they had been previously healthy, and it made me really nervous because it looked like someone who could be a friend of mine, and this was the first patient that I was physically around. We got the patient into the room, we had to connect them to the ventilator. It was concerning, like, are we going to put aerosols into the room? Are we protected well enough? So we all felt very on edge, nervous that everything was going to go okay. I felt like personally attached to that patient. I really wanted to see that they did well, knowing that they may not do well, and they did end up leaving the hospital. They were able to go home. I kind of wish that I could talk to that person. First, I would want to say that I'm just so thankful that he made it. Yeah, and I would want him to know that we all care very much, and everyone that comes to us, we want to see them get well. We know how much it impacts their families, and that they weren't able to spend time with them, that we took personal interest in really seeing them succeed. And I would just want to ask him, like, how he's doing. Yeah, how are you doing? How are you feeling? And that I'm just so happy that you're okay.
My name is Kathleen Saunders, and I'm a registered nurse in Med-Surg ICU at the hospital here. Things got so much better during the summer because the first wave was sort of over, and then it ramped right back up when the second wave started hitting, thinking that, well, we know what to expect because of the first wave, but this wave is different because this wave just keeps coming and coming. Listening to the news and hearing the numbers go up, you sort of get a little more anxious each time. Watching the numbers go up in our unit, that kind of makes the anxiety go up. So right now we're at a pretty high level. So the anxiety is pretty high. I'd say it's probably pretty close to where the first wave when it hit, just because we are so busy and the patients are so sick. A lot of times these people come in and they get sick, and it happens very quickly. So they get sick with the symptoms of the COVID, and then they get very sick very quickly within a matter of, sometimes it's hours or days, and all of a sudden they're on life support in the ICU when a couple of days ago, they may just have had the cough or the fever, and all of a sudden now they're on full life support. So for the family to comprehend that kind of without really warning. I mean, the warning's out there that the COVID is there, but to be touched by it personally and see it is very hard for them. They don't have any preparation, and then not to be able to visit and not be able to talk to them, it's hard. The families aren't able to come in, and that's actually probably one of the hardest things. The families can't come in to visit the patients because the patients are COVID positive, so they're getting all their information by the phone or by like a video call, but just you can't offer them the same kind of support. You can talk to them, you can give them the information, but there's that distance. You don't feel like you're sort of right there to put your hand on their shoulder to offer the support when their loved one's so sick.
I guess I feel like I live with this constant hum of anxiety. I never know really how things are going to go. As I watch the news and I see numbers going up, I'm like, okay, wonder what work's going to be like tomorrow. How many admissions are we going to get? How sick are the patients going to be? I talk with my colleagues who work at other hospitals and hear what their numbers are like, and I'm like, okay, it's building. So you do live with that sort of impending feeling of, okay, it's coming, it's getting worse. How are we going to manage? Because the hospital ICUs are full. Yeah, we've expanded, we've created new ICU beds in another area so that we can still try to support the surgeries and support the incoming COVID patients, but we're all feeling very stretched. And then you're also going home, like for me, I have young children. So I have to keep up with that part of my life as well, and that can be hard. So yes, we're physically tired, and I also, feel emotionally tired. Worrying about my patients, worrying about my family, worrying about my patients' family members that aren't able to be at the bedside with them as well. My children are handling things okay, and I think the only thing that's changed is, especially during the first wave, I would worry when I would come home, I've got to, quickly go up and have a shower. I don't want them to touch my bag that went into work in case the virus is on it. When I've come down with like a sore throat, I wonder, I'm like, was I exposed at work somehow? Am I bringing COVID home to my children? Sometimes you pause and think when you're about to give them a hug, and it's unfortunate to live that way and have those fears. I sometimes feel like we're drawing from an empty tank at times, but I know that this won't last forever, and I just try to push through because it's my duty. I want to help and take care using my expertise I just want to do the best I can, and so we just push along.